So welcome again. This is our Madison Tug virtual summer meeting. I'm Sarah Weber, one of your leadership team members for the Madison Tug. And we're just really happy to have you. We know right now there's absolutely no shortage of Tableau related virtual events that you all can tune into. And that's amazing. I know I have a whole laundry list of things I'd love to watch. I don't always make it live. I always mark to record them, but that can be a challenge too. So being virtual for all things has opened up the door to so much, but it does kind of present an interesting challenge for us as your leadership team and how we can create events that will continue to both educate and inspire you, but also that provide some of the value that we feel like our traditional in-person events have been able to offer you. So that's really the inspiration for the survey that we sent out, and we'll hear more about that in a few minutes from Jen. But in the end, it really comes down to us wanting to do our very best to bring you things that are showcasing local speakers and local content, and today's meeting is a great example of that. We want to connect you up with other data junkies in the area, allow you the chance to compare notes, learnings, and simply network with one another. We love that we might have some more visitors from far and wide across the world, really, for these virtual meetings. But we also want to make sure that all of you from our local Madison Tug continue to feel connected to each other and to what's happening in the Madison area. Hopefully when all of this is over one day, it will be a huge party, as we've talked about in our leadership group, a great in-person event. So with that, I will introduce you to our leadership team. So all these folks, I believe, are all on the line today. I won't go through everybody, but all of this group works really hard to bring you that important content, and we would love your feedback along the way. We'll talk a little bit more about that towards the end of today's session. But our meetings couldn't happen without this amazing group of people and their energy and passion. Today's agenda, we are kicking off doing some welcomes. We'll have an attendee poll. We've done that the last couple of meetings, and it's always really fun, especially in virtual meetings, to get a sense for who's here, answer some fun questions, and just get a sense for who's in the audience. Then we'll jump right in, and we're going to try out something new with some networking and breakout rooms, which may sound scary to some of you, maybe data introverts, but I promise it will be painless. And it's also your chance to win some swag by participating in those breakout rooms. Then we'll jump in and get a few updates on our member survey and volunteer updates. And then we'll get to our main presenters. Today's focus is all about how Tableau has been helping local organizations in their fight against COVID. So I'll do a short presentation on some things that I've done at American Family. And then we've got Wisconsin Department of Children and Families and the Department of Health Services on the docket as well. And then we'll just have a few closing out slides to keep you informed about upcoming events and important reminders. So with that, Jen, I'm going to turn it over to you to introduce our audience poll.
Thanks, Sarah. Yes, we have just a couple of questions for you to answer, just fun little interactive element to get to know who's here, get to know each other. So we'll give you a moment here to either scan that QR code if you have a code reader on your phone, or you can type in that URL on your phone or in your web browser to bring up the poll. So I'll give you just a second for that, and then we'll kick the poll off. Okay, hopefully you're all getting that code in there. You'll see it one more time in just a second. Sarah, you want to go ahead and share the results? We're going to not only do a poll, but we'll actually show you in real time how people are responding to the poll. So there's that code one more time, and that QR code. Hopefully you all have gotten in, and here we go. Our first question, just wondering, where are you all joining us? I know we're all virtual, so how many of you are calling in from your home or one of these other options? So far, home has it by a large margin. Few people in the office. Well, I hope you are careful and socially distanced there. No coffee shop takers, huh? Guess it is an afternoon. Smoothie shop. Looks like that might be our responses. Okay, almost everybody's at home. Sounds good. Okay, how about, this is our Madison Tug meeting, but as Sarah was mentioning earlier, what's great about these virtual meetings is it gives us the opportunity to maybe get in a few additional people who might not otherwise be able to join us. And yes, indeed, looks like we've got some people from outside of our main metropolitan areas. Even got a few people from outside Madison, welcome. But Madison people by and large, which I have to say is what I expected to see. All right. Welcome to all of you who are not from Madison, and welcome to all of you who are. We're glad to have you here. All right, next question. So July was Certifiably Tableau month. We'd like to know if any of you are still working on or went ahead and earned yourself a fancy Tableau certification. So you see the options there, including an option there for those of you who might have been extra ambitious and working on a few. All right, looks like a few of you have earned some desktop certifications. No server love today. Okay, maybe a goal for 2021. So most of you not working on certification, but we did have some desktop folks. That's great. Okay, next question. So we've all been dealing with COVID for the last few months, and I'm going to assume that it's not just been completely business as usual for you. So hopefully something has been helping you get through, maybe one of these options. Anything helping you out? I see a lot on exercise, meditation, yoga. That's great. I am very curious about the something else, but we'll just all have to imagine what that might be. Some beverages, sure. Cooking, I think probably I'm not the only one who's been experimenting with sourdough. Something else equals gardening. Awesome, I do a lot of gardening too. Thanks for sharing that, Sarah. Home renovation, yes, lots of things to keep yourself busy and your mind occupied, but by far, it looks like exercise and meditation yoga has been helping. That's really cool. All right, and one last question. What is your personal relationship status with COVID data? Are you an obsessive, looking at, checking the data, looking at updated numbers, public displays of affection? Are you actually out there creating and sharing some visualizations? Are you a secret admirer? You like looking at other people's work but haven't been doing it yourself? Or you know what, I'm so over COVID, can't even be bothered. And a lot of secret admirers out there. Well, you are the perfect audience for our presentation today because you'll be seeing some work that others have done related to COVID. Very cool. All right, thank you all for participating. That was fun.
I will flip over back to our presentation. Moment of truth, if I do this right. Bear with me 1 second. Oh. Okay. Are you all seeing my slides okay now?
Yep, I see them. We're on the breakout room slide now.
All right, thank you. Okay, Sarah Legates, I'll let you take it away and explain to the group how breakout rooms are going to work.
Good afternoon, everyone. Welcome and thanks for joining us today. We're going to try out something new for this virtual meeting. We know how much we all enjoy the opportunity to talk to some of our fellow Tableau users when we come to our live and in-person sessions. However, we sometimes don't get that chance when we are in virtual mode. Today we wanted to try breaking out into small groups, and by small we're really looking at about 6 or 7 people per group. So this will give you the chance to have some more intimate conversation with a few people who you may or may not previously have met in other meetings. The first session, we're going to meet for 7 minutes, and we would really enjoy it if you could all introduce yourself and talk a little bit about, in the first session, our topic is going to be how has COVID impacted your work or impacted your company? When we've had about 7 minutes of time in that session, we're going to return to our common group, but not for long, just long enough to kind of review the session 2 topic, which we're going to introduce you to a brand new group. The second group will be a different group than your first. And in that session, we'll ask you to talk a little bit about any Vizes that have recently caught your attention. We know that there's a lot of amazing stuff coming out around COVID, but other visualizations that you may have seen in other venues. And when we come to the second session, it's going to be your opportunity to win swag. In our second session group, 1 winner per breakout room is going to be selected for the swag giveaway. So just watch for that, and that will be automatically recorded, and then we'll share that information with Patrick McCormick, and he'll be contacting you for the swag. So we are all set and ready to go. And mind you too, if you are new to Zoom breakouts, or if you're feeling like this is not the thing for you, you can choose not to join the group. But we would really love it if you would join, just as a chance for everybody to get to know everybody a little bit better. Okay, so I'm going to create those rooms now. Here we go. And that leaves just a few of us here sitting in the open session. If you want to chit chat with us, I'm not assigned to a group because I own the breakout rooms. I don't know that I have much to talk about here in the open session, but if you're here and you want to chat, or if you're here and you have not yet joined your breakout group, you can do that whenever you feel ready. Otherwise, I'll tell you all about all the tomatoes I've been growing this year. Man, oh man, I've had a bumper crop of tomatoes. They're little itty bitty, cherry tomatoes, and whew, got a lot of them.
I have canned about 40 quarts.
Oh,
and
wow. Okay,
17
so
more
you're
to go.
you're beating me on the garden. I have 3 tomato plants, and for me, this is a big thing. We just put in a
That's awesome.
garden bed, like a raised bed, and this spring, and I've got a basil plant, and I've got oregano. I had some perennial oregano that has been reseeding itself for years, and added some tomatoes and cucumbers, and yeah. So anyone else who has not joined their breakout room and happens to be sitting here with us, you can join leadership. You can see behind the scenes, your Tableau user group leaders are regular people who talk about regular stuff. And it's going to be pretty miraculous if I make it all the way through this whole meeting and don't get interrupted by something. The cat has just come downstairs and announced, I'm not sure what, but he's probably going to jump up here and wave himself around to my camera. Yeah, he does that.
Yep. Awesome.
I guess I was going to broadcast a message on this one of how has COVID impacted your work? I am not going to join any of these breakout rooms, but I can see them. I know they're there. That's good. I guess I could have talked a little bit more about, you'll have a button that says join. And then when it comes time to leave, you'll be kicked out on your own. I got a little timer going on my watch, 2 minutes and 54 seconds remaining. Here comes my cat. He's magically not touching any part of the screen except, oh, there he is. Told you. This was my big worry for this whole session is like, I can't manage a stretch on any given day of 2 hours in which I am not interrupted by the kids, by my husband, by the cat. The dogs are not downstairs with me, but at some point they will break out barking.
Yeah, 2 hours is a long stretch for my
Yeah.
family too, so we'll see how it goes. But when I told them there was potentially 100, 200 people that are going to be watching, it did make them be like, oh, I don't want to be part of that.
Yeah, if I had said that though, my youngest would have been, Mom, I want to be in your meeting. He likes the socialization. It's a little scary, you know, where it's like, ooh, you know, for him, but he really likes getting extra company. So, all right. It feels really weird, like we've been in this forever, but I still have 1:41 on my.
All good.
Oh, we have people who have joined the meeting apparently after the start of our session. So I'm just going to assign these folks now to new breakout rooms. But I swear, I feel like my timer is working strangely, but I'm sure it isn't. It's a regular timer. It's working. It's not accidentally. Oh, see, this is kind of cool. We got new people coming in. I have to broadcast.
For those of you that decided not to join the breakout rooms, hopefully you're just being entertained by our really not entertaining banter, or getting some work done and multitasking. So just don't forget that in session 2, you have the chance to win some gift cards to local businesses or the Tableau store. So
yeah, we should definitely. Sarah, do you want to say some words about that? I'm going to close the rooms now. Well, do you want to say anything to the group when we return to say, hey, you know, your gift cards will be local?
On the next slide. So you can just introduce the thing and remind people that it'll be part of swag, and then I can cover it after.
Sounds good. Welcome back, everybody. I see lots more cameras on than there were when we started our breakouts, which is great.
It's nice. It feels more real, doesn't it?
Yeah.
We're not just talking to a computer, talking to a camera.
Okay, so it looks like almost everybody has come back. Breakout room 10 is having a really good talk. I like it. And so is breakout room 8. I love it. See people who are still in their rooms chatting. It looks like everybody's back now. Welcome back, everybody. Thanks for jumping in and participating. And we'll take a second to regroup here. And I think I have to reset these rooms. We're all new together today. I've never run breakout rooms before, so this is my first my first behind the scenes with Zoom. And as a reminder, for session 2, you will be going into breakout rooms with a new group of folks. You may still see some overlap, of course. And in this session, take the opportunity to talk about any visualizations that you might have seen recently that caught your attention. And now, Sarah, I'm going to ask you to say a few words just so that I have a chance to focus on
You bet.
work in these rooms.
You bet. So just a reminder that in the second session is your opportunity to win some swag. If you've been to our in-person events, you know we love to give swag. We love to do fun local snacks and treats and spoil you that way. We can't do that virtually, which is disappointing for us too, because we like to eat and support local businesses. So in lieu of that, we will still be giving some swag away, which will come in the form of e-gift certificates because they're easy to distribute. But we did get some certificates, one per breakout room, and you'll have your choice of the Tableau gear store, so you can get some Tableau swag, or a gift card for Nitty Gritty, which has locations all over the Madison area, so you could get some takeout, or if you're comfortable going to the restaurant, whatever it means to you. So make sure you join those breakout rooms and get that chance.
I'm ready. I'm going to open the breakout rooms now.
All right.
Enjoy, everyone.
So we will be slightly behind schedule, but that's okay.
I can make this session a little shorter. I got to take a minute here and
yeah, why don't we
record.
do it at about 5 minutes? But yeah, I'll let you do your thing. I know you got stuff to do.
Okay, so I have recorded a list of names, and I will be able to share this with Pat. We're down at, I set the timer for 6 minutes, and Sarah, you said let's go at 5, and it takes 1 minute to kick everyone out. So you do want the breakout session to last 5 minutes, or do you want the breakout session to last 6 minutes? You're muted, Sarah.
Classic. You can go ahead and decide that. You are in charge of the breakout room.
Well, I don't know how far behind schedule we are.
A few minutes. It'll be all right. We'll make it up.
Yeah, okay.
Or not.
I'll just,
I'll
close this. I'll close this here in a moment.
That sounds fine.
There we go. Rooms are closing.
And then Sarah, did you say you're going to have Pat, you're giving him the names?
Pat had said in our last meeting that he was going to handle distribution of.
Yes, but are you reading the names of the winners?
Why don't we ask Pat?
Did you send them to him?
Not yet.
Okay. I think since you have them in front of you, if you're okay with it, I think you should just read the names.
I certainly can.
In the interest of time.
Okay. I admire room 10, who are still chatting. Welcome back, everyone. I hope you enjoyed your opportunities to chat. I love, had some groups who talked all the way up to the end, which I really thought was fantastic. And for those of you who came back early, that's fantastic too. I hope you all enjoyed the opportunity to chat and make some new friends. And I know this is the moment we have all been waiting for. I am going to take this opportunity and we'll go through the chat rooms, and I'm just going to list out winners. Those of you whose names were called, first of all, I want to apologize fully in advance. I may or may not say these names correctly because that's just how names are, right? And if I say your name and I say it poorly, please feel free to jump in and correct me. And I do have one name of an individual where I've only got what appears to be a first name. So if that person, when we come to your name, hopefully you'll be able to fill me in with a little more information. So in breakout room 1, our winner was Mia Starling, or Maya, I'm not sure. Breakout room 2, we had Joe Warbington. Room 3, we had Michael Smith. Room 4 was Renee Byer. Room 5 was Kelly Olson. 6 was Michelle Osnes. 7 was Rochelle Day. 8 was Sarah Carr. 9 was Brad Parkell or Parkell. Brad, I see you nodding your head. I've got you in my little window of 6 here. So 10 was Kristen Schmidt. 11, please forgive me, I think it's Chaitanya, and I'm not sure if I'm pronouncing that right, but I only have a first name. You've logged in only under...
You pronounced it correctly. Yeah, that's Chaitanya.
Okay. Chaitanya, do you have is there a last name I can add to this? Like, did you register with a first and last?
Yeah, it's Viraya Gari.
Or you
it's
could,
a very big name.
Could you chat it to me? Send it in the chat.
Sure.
Okay. And in room 12, we had Jody Tessman. So congratulations to all of you. And that is it for our breakout room sessions today. Hopefully we all got a chance to learn something new about each other. And Sarah, I'll hand it back to you now. Thanks.
Sounds good. Thanks, Sarah. I know that was something new for all of us. We'd love your feedback on how that went for you. I'm sure awkward in some ways, and I'm sure fun in others. So let us know if the group loves it. It's something we can continue moving forward. If not, we'll adjust. This is your meeting, and we want it to be enjoyable for you. So if your name was called, we will be in touch via email through your registration email, and let you pick out your certificate and go from there. All right. Jen, I'm going to turn it over to you to talk through some volunteer updates.
Yeah, just a quick update. So you've probably known that we've been doing this volunteer stuff for a couple of years now. It's one of my favorite things about this TUG. COVID put a little bit of a halt on our plans, at least on the in-person side. So we canceled all of the things we were planning to do together as a group this year. Hopefully things are looking better and safer next year and we can get back into our food banks and making sandwiches for the kids and all that kind of stuff. But we have been moving forward with our data related, using data for good. So we actually are just about to wrap up our work with the Nature Conservancy. They're doing a final review on their marketing team, and then those should go live on their website. And we'll probably tweet that out. Hopefully they'll be happy about sharing their content, and we're excited for that one. And then Madison Cat Project, we've started working with their data, and hopefully we can share out some of that work when we get that a little further along as well. So we haven't given up on our doing good and being part of the community. It's just looking a little different this year than we had thought it would. So stay tuned for more opportunities. And next we want to talk to you a little bit about the survey that we sent out after our Q1 meeting in February. We had thought our Q2 would look like it always does, or we'd have our big Viz comp and we had plans underway. And then again, COVID just changed all of those plans. So we regrouped. We realized this was not just going to be a short-term thing. And we asked you all, what do you think about maybe just doing this virtually? So everyone who responded said, yep, that sounds great. So here we are. And we asked about cadence, and quarterly was most popular. So we're planning to stick with that as best as we can. And we also asked a little bit about what types of content would you want to hear in these meetings? And these 4 options you see on the screen are the order in which they received the most number of people saying, yes, this is what I want to hear more of in these meetings. So people really wanted live demos or how-tos or more tutorials. So you'll definitely see some of that today. But they were interested in theory and strategy, member presentations. We're covering that today as well too. And then a little bit less interested in us finding some of the videos from other events that have happened, or just kind of pointing out some specific things we think would be super relevant. So we'll mostly be trying to focus on the number 1, 2, and 3 ranked things, but we may do a watch party. We'll see what you can get from us out of the next few quarters. I also wanted to mention we do have a Slack site that we have had going for a while now as well. We have quite a few of you who have joined, but I'm not sure if everybody knows we have that. One of the comments we received on the survey specifically said that now that everybody's working from home, they're having trouble getting the support that they need to do Tableau, and would love to be able to ask questions of other people and maybe do kind of like a Tableau doctor sort of thing. And I thought that was a fabulous idea. And so I actually started a channel in our Slack site called Tableau Doctor. And I check our Slack site at least every weekday. And I would be more than happy to keep doing that and keeping a special eye out in that Tableau Doctor channel. So if one of you had a question and wanted someone to help out, please join our Slack site, please join that channel, and we can all hopefully stay in better touch. If you'd like the breakout sessions, maybe you can reconnect with your friends that way. So there's a plug for our site, and hopefully we'll see some more of you over there. All right,
Hey,
Sarah,
Jen,
back to you. Yeah.
how do people volunteer? How do people raise their hands to participate in some of the volunteer opportunities?
Yes. When we have another project ready to go, we will send that out probably through email. Depending on the timing, we may be able to announce that and talk about it in our next virtual meeting as well. But right now, we're just wrapping up the couple we had already committed to. All right. I think that's it then, Sarah. Back to you. Sarah, you're muted. We can't hear you.
Got it. Thank you. So we will jump into our case studies in local COVID analytics from our very own TUG members. So I'm going to do just a brief intro on some things that I've been working on, and then we'll turn it over to our partners at the state. Like many of you, and I'm sure your companies at American Family, we definitely found ourselves in uncharted territory when COVID hit earlier this year. I know I started working from home by mid-March, and it didn't take long before I was started getting requests to help pull together some Tableau views that could get us just more insight that would identify areas of opportunity in this new world that we were facing. Early on, it was related to multi-factor authentication. So we had people who maybe weren't used to working from home on any kind of frequency and just didn't even have accounts set up and things like that. So I early on built some views related to who had accounts, who didn't, by team. So we could give managers insights, we could give people extra help as needed. So we solved that problem, and then we jumped right into the next, which was really looking at those trends of logins from remote activity and just seeing if there was anything we could do to help people in this new environment that they were navigating. And so that was early on, and over, we kept finding new ways that we could leverage Tableau to help answer our questions about how we would make sense of this new environment that we were all trying to work in. We certainly have been using Tableau to understand impacts to our customers, our premium relief program that you may have heard about in the media, or maybe even receive some checks yourselves, which would be great. I know I appreciated getting that check. Understanding the impact of that and how much we could commit and give back to our customers. All of that, Tableau was invaluable in those types of analytics. But the one I want to talk to you about today is about understanding the risk that COVID has presented for our employees, specifically in the IT space, and how that could also inform our return to office analytics. There was still so much unknown about there now and all along, right? We've had so much that's been unknown about this virus, and there's still a lot of unknown even within our own companies about what returning to work should look like, and we're all trying to come up with those plans. So that was really the goal of this analytic effort. So some of the things we wanted to know when we first started talking with our IT leaders was, what is the current risk for our IT staff across our enterprise? I'm not sure how many of you know, locally in Madison area, obviously American Family is a huge presence. It is our national headquarters, but we actually have regional offices across the entire country. And we also have operating companies that are across the United States as well. Big offices in Massachusetts, Florida, and Tennessee. And those are separate, like I said, operating companies. We have the general, so you might, the shack ads and all of that is part of our enterprise. Home site insurance, Main Street America, and other groups like that. So this wasn't just about our local branch of American Family, it was about our enterprise and what is the risk going on there. Certainly our first and second line managers have a sense for where their employees are located. Obviously they know if somebody works in Madison or in another state. But when we look at it from a leadership level at that broad scale, we really wanted to understand where people are and what risk are they facing in their local area as it relates to COVID in terms of cases and deaths and all of that. So we really needed a way to assess the risk for all of those IT employees, which is around 2,300 people. We also needed to understand the risk to the critical IT functions themselves. If our employees would be unable to work because maybe they get the virus or someone in their family does and they need to be off of work, anything like that, needed to understand the impact of that to the business that still needs to happen to survive as a company. Obviously, business continuity is not a new thing in many large companies. We have those plans in place. So it's not anything that was new to us, but COVID certainly took it to a whole new level and a very real and present danger that we were all facing. And then leaders were also really interested in understanding, again, as a whole, how the staff was managing in this remote environment. I think we all kind of surprised ourselves at how well we all took to remote work. Typically in an IT world, many people already had the opportunity, on Fridays, some people would work from home depending on their role and if that made sense. So in some ways, that setup was there and it was just a shift to having that be a permanent kind of lifestyle. But we definitely all surprised ourselves at how well the company as a whole adapted to the new environment. But just because we adapted, that didn't mean that that was something that should remain forever. And if and when it was safe, what should that returning back to the office strategy look like? Who wants to come back? Who might feel like they've been doing really well at home and just wants to stay in that environment should the opportunity present itself? So in order to answer those types of questions, first we had to get the data, of course, which is always the fun and not always easy thing to do. So first and foremost, we said, well, in order to understand our people and how they're feeling about remote work, we need to understand, we need to hear it from them. So let's do a survey. It went to first line managers, and we really hoped that they would have a conversation with their team members and then report back on a few key areas that you see in the white box on the screen. So the first was related to returning to the office, and they could select whether or not really they're in a role that has to be on site in some capacity, maybe a data center operation, something like that. And then we could say for each employee whether their productivity was better on site. So maybe their internet connection just isn't great, or they have too many distractions like cats in their faces, to nod to Sarah Legates. Or if really a preference for remote work works for them. So that might be just because they like it better. It might be they need to be because we don't know what's going to happen with schools. Their underlying health concerns make them not want to return to the office. So those were the core options. Of course, we gave in other options. So if there were other circumstances that they could note as well. The next question related to impact to mission. And this is really about the answers you see here, whether it's low, medium, or high, and how well that work would be, how much that work would be impacted should they not be available at some point due to the virus. And then we also asked a question about the type of work that employee does, so whether or not it was more operational versus transformational. So we gathered that information in a survey. And then we also reached out to our friends in our HR team to get employee level information, mostly about their home location, as well as their leadership and departmental hierarchy. The final piece in the data puzzle was really getting the COVID data. So I had the employee information, I had the survey data, but how could I really tell the story of the risk that COVID was having for those people in their locations? Now, we all know there's definitely no shortage of COVID data out there, but that made it even worse, right? Like, how do I know that I'm picking the right information, that it's trustworthy, that it's been vetted, and that I'm reporting on it appropriately and responsibly, and all of the ethics that go around COVID reporting? Now, I wasn't looking to tell any story other than the facts about COVID as it relates to our employees. So employees first and foremost, and then what are the relatable facts about COVID. So that's where our friends at Tableau really came through. If you're not familiar, I have the links here and you can just Google for these. Tableau created the COVID-19 Data Hub, which also included a Jumpstart workbook, which will look very familiar when you see my view in a few minutes, and then also downloadable data. So using some tools that Tableau provided in their Data Hub, I was really able to get the ground, kick off my effort on the COVID side, and then just focus on bringing in the AmFam data to supplement it. So with that, I'm going to just jump into my workbook and show you a few things. All right, hopefully you are seeing a Tableau dashboard. So this first view, we are looking at, it's basically the Tableau Jumpstart workbook in a nutshell. So a few options it walks through. I can select whether I'm wanting to see new or cumulative cases, and I can look at positive cases or deaths. So I like to look at the cumulative cases as an indicator of what's happening in an area as it relates to our employees. You'll see it gives you some history. It tells you against previous day. The data that is available in the Data Hub is updated every single afternoon. There are web data connectors, so you can connect live. At this point, I'm updating my dashboards weekly and I'm doing it manually at this point. Depending on how we move forward, I will likely investigate how I can connect using that web data connector. And I can drill in to see how things are going in a given state. It brings me to the county level. I modified the baseline views that they provided to incorporate things like in this tooltip, you'll see enterprise IT count is 781. I also added color intensity to the views over in this is a county level view at this point, and the map so that I could see, okay, lots of employees in Dane County of Wisconsin. When I go back to the all state view, I can see, yes, Wisconsin, a lot darker shade here in Massachusetts, Tennessee, but in general, not a lot of staff. Florida does have a decent count as well, just not shaded quite as much just due to Wisconsin's high counts. I also added in this section on the right just to help give the picture of these breakdowns. You'll see that modifies when I click Wisconsin. It now shows that I have 1,053 IT staff broken across these different companies for the state. So that starts out with the COVID data, but what I really want to do is show how that relates to our enterprise IT staff. So this takes a more of a lens of from the American Family side where the COVID data is kind of secondary. The left-hand side of the screen just says where do people live? Where is their home location? So if I'm a leader at one of these companies, I can filter down for my own company. I can select from a leader dropdown. It's just removed to protect names. I can select departments or a home state to be able to drill in. Highly interactive views throughout this entire thing so that I can say what's going on in a given state. It updates the other charts, just like many of the dashboards I'm sure many of you build. One thing that I was proud of myself for on the right-hand side, I have this secondary view. These don't interact right now well with each other, but this hand, the right-hand side here walks through, I can do the same types of views for cumulative positive cases and deaths. And then I can see how they relate to the selected COVID metric or IT staff. So right now I see I have the most staff in Wisconsin and where they stand in their cumulative positive cases. I can flip using this parameter to change my sort metric so that I can see it by selected COVID. Texas is the highest and how many staff I have there. So this gives a little better picture, I feel like, than the initial view that we looked at the COVID-19 data, just in really understand the correlation of where our employees are in relation to COVID stats that I want to look at. Then I just created some statistics just so people understood who had completed the survey, what percentage are we looking at. And then I jump into the survey data. So the first was really interesting, not necessarily surprising to us, but fascinating just the same, the number of staff that really would like to continue working in a remote environment. And that was 57% across all of our companies. But then again, being able to drill down as a leader or an end user to say, based for my specific team or downline, what this looks like. So this will help our leaders help inform return to work strategies as they assess what people are interested in coming back to work. And then again, saying, okay, these are the people who either need to or want to be in the office. Now I can look back at that COVID data and say, well, what's happening there today? Okay, now is not the right time. Those types of decisions. Then I've got the impact to mission and the type of work that they're doing. So again, looking at where our staff live, employee listings that filter down based on my selection. So if I really want to see who are those 5 people, I can get their names and talk to them directly as I need to. So when we look at the impact to the mission, so if something happens to them, how much risk are we in across our brands and the type of work they're doing. So just informing, again, our leaders, the impact that COVID could have should it hit a certain area of the country, and what staff are there. And then last but not least, it was just a general listing. If somebody wanted to see the full list, because everybody loves to see the data, we provided that as well. So I'm going to jump back to my deck. So what's next with these dashboards? So our IT leaders now are reviewing it, making decisions about how the views could be more helpful for them, sharing it amongst themselves, and determining our next steps. We've talked about considering the expansion of going beyond IT. That takes it to a whole new level. It was not a simple process for the survey. And also even the HR data from our operating companies, compiling that in a format was very manual, as much of our data always is, I think, across industries. So there's a lot of operationalization and automation that would need to occur in order to make this a living, breathing thing moving forward to assess overall risk. But it's been really exciting and nice to see our leaders feel like they have a better picture of our staff and where they sit in terms of risk and their how they're dealing with returning virtual work. I will take a question or two if we have time. Otherwise, we can see how things go at the very end, or I can answer them in the chat during the other presentations.
I think we better just do chat, Sarah.
That sounds good. I have no idea what timing. All right, let's do that. So up next, Jen and Robert, I will let you take it away.
Hello, everyone. My name is Robert Salas. I hope I'm off mute. Can somebody confirm that?
You are.
Yes, we hear
Great.
you.
Thank you. So my name is Robert Salas. I work at the Department of Children and Families. I'm the reporting and data visualization lead. I've been in that role for nearly 10 years in our business intelligence section. And I have the luxury and joy of working on multiple projects across the whole department in different business areas. And given that it's state government, we have a pretty big diversity that obviously outwardly serves the public. And in this case, the things that I'm going to talk about are not related to COVID-19 itself, nor of understanding the virus and its impacts, but rather in supporting families as they try to do as we are, which is figure out how to have life and return to work and take care of your kids and so on and so forth. And DCF is really focused on improving the life and welfare of children and families. It's literally in their mission statement. And so these products that I'm going to show you today were really aimed at achieving some of those goals. Just a little bit more about me. I do lead our data visualization and reporting team. I am our Tableau site admin for DCF across the internal external servers and the lead developer within BI. Jen Shepard and I are colleagues, and I would say she's also a lead developer within the department, so I can't claim that as my own sole glory. An interesting little thing about COVID, a little side story tangent here, is that on March 4th of this year, I left the country for a trip overseas, literally as far away on the planet as you could get. If you think about antipodes of Madison, I went to Perth, Australia, and about 200 miles from Perth is literally the opposite side of the planet from Madison. I checked. And about a week or so after being there, we started hearing, things about this virus and Wuhan and oh boy, this could be trouble. And we literally threaded the needle coming back when airlines and airports were shutting down and landed in Madison, Wisconsin on March 16th. 2 days later, Australia closed its border. As we all know, we had stay-at-home orders immediately enacted. And so I haven't seen my office or desk for an extra 2 weeks more than everybody else. So it's been very surreal to go away and come back and suddenly be enjoying the privilege of working at home and now feeling like a prisoner of working from home. So I'm sure we all feel that way. So as we came back and COVID was spreading across the country and the world and across Wisconsin, going back to work went from 0 to 60 to 150,000 in a matter of just a few days. And given the priority and focus that our work took as related to COVID. We took almost the entirety of our leadership team within BI and pulled myself and a few others out to work exclusively on COVID-19 work, And over the course of maybe 7 to 10 weeks, we created a total of 6 products, which is to say things that are combinations of dashboards, but they were comprised of 12 dashboards. And I'm not going to go into detail about a bunch of these, but just to highlight that the variety of things that were running simultaneously and everyone was focused on around supply and demand and where there were needs and families had shortages, and for management to understand what they were seeing and what was happening. There were just a lot of things going on. And we did an internal presentation about a week and a half ago. So in the course of what normally would be 1 or 2 singular projects, we actually built like 10, which was at a breakneck speed. So I just want to call out, to our whole team at DCF and acknowledge that there's other staff in our whole team that had very, very important and more invisible roles than I did in this effort. And I try to always remember, data visualization is at the tail end of a very long train that involves a lot of pieces and parts and other people. So there is no data visualization without the data, and there are other people who do that, our ETL developers and database people. So just want to acknowledge them in this glorious, show, Dog and Pony show as well. Okay, so again, as I said, returning back from being away, all of a sudden this COVID stuff is upon us, and the department is saying, you've got to get stuff out there. We need these things immediately. And what I'm talking about specifically is essential workers who were being called upon to still show up to work, and we know who they are. But schools were closed, and what the heck do you do with the kids? And how do people find childcare when they're trying to work double shifts at hospitals or being called in for overtime at grocery stores and being worried about their own health? And that's what we focused on, was childcare related servicing. Now, as I said a moment ago, data visualization requires actual data, and a lot of what was needed and what was desired didn't exist yet. So I had to push back quite often and say, I can't make you a beautiful dashboard if there's no data available to show. I can just draw you a picture in Microsoft Paint. Nobody laughed. So sometimes we had to move forward with temporary data collection. There were a couple of items that came through SurveyMonkey, which is useful in its own way. I'm just going to say as my own personal opinion, I hate the data from SurveyMonkey. We did a couple of experiments and had a few proof of concepts that we did temporarily using Google Docs. And then we had a lot of stuff that was based off of manually created files, primarily in Excel, a few CSVs, etc. We had a lot of new or unavailable data that was created in this fast-moving environment where policies were being written in the morning, the application team was being engaged in the afternoon, they were coding and going live the next day, and then we were trying to bring it into our data warehouse side of things that same night or the following day. Just everything running in parallel, simultaneously, overlapping, weaving in and out, daily status check-ins, the fastest I've ever seen any super hyper agile project ever go. But what this led to was really good cohesive communication between the data visualization needs and the business requirements to the application team and into the data structures. So the first thing that I'm going to talk about today, ironically, the two that I'm going to talk about today are our first and very last products that we created for COVID, because they're the only two that are publicly available, and I can't show you the internal products. So this first one was the emergency childcare map search. And what this came out of was a realization that people were, again, these essential workers were going to need childcare. And who would they call? They would, of course, call the Department of Children and Families that administers the Young Star information and childcare licensing and say, what's open and where can I get childcare? And that started immediately, and it was a little bit overwhelming. So I think it was on a Wednesday that they said, we need to build something that the public can look at. It needs to be a map, and it needs to be interactive, and they need to be able to, try to get at their own answers, and we need it as soon as possible. And this is the final outcome. This is 10 iterations later, but what this is for people to be able to locate themselves, assumedly they know where they live or where they work, and they can get to there on the map, and figure out what child care facilities are nearby that they can contact themselves and see if there are slots available for them to put their kids there so they can get to work. Just kind of a quick overview at the top, there are some filters to apply in order to home in on a location. There are some additional filters related to perhaps the age of your children, if they need to serve special needs, and then specific provider types. It's pretty simple to interact with, And again, the focus is getting down to a manageable list where somebody would pick up their phone and actually make phone calls. This was an immediate top priority for the DCF Secretary and the State Emergency Operations Center. They threw this requirement out to us and said, drop everything, do this ASAP. And less than 7 days from that go, we had something initial put into production and on the DCF website for people to start using. Over the course of another 6 weeks or so, went through about 10 iterations of adding features, adding the hospitals, adding individual providers as they became available, adding additional filters as they were added into the source application system. And again, what its purpose was to provide some self-service capabilities for families so that they could find their own childcare as they needed it, at the times that they needed it, on the days that they needed it, instead of trying to coordinate through another agency or a broker. When this was initially released, within the first week, it had over 2,000 hits and views. And currently, as of yesterday, it was over 13,000. So demand for it definitely slowed down and stabilized, but within the first couple of weeks, it was a little bit off the charts. And we were talking this third week of March. At its high point where the data was changing very, very quickly, so we're talking about during the stay-at-home orders, we're talking about when COVID was spreading across Wisconsin a lot, childcare centers were shutting down from day to day, week to week, as providers themselves got sick, as kids got sick, as people were identified as testing positive. And so there were multiple methods for providers to report on their status of being open or closed, and we had to evaluate all of those. So we were updating this data every 15 minutes to reflect that rapid data change. Here's just a quick example of how one would use it. So I typed in here my own zip code. If I were looking for childcare for my 2 kids, I would put in 53705. The map re-renders and shows me everything that's within my area. I can obviously zoom in, and I know where I live, and I know where I work. So again, we weren't able to leverage more sophisticated geographical technologies to match people with a provider, but rather give them resources that they could easily make a phone call. Each of the blue diamonds represents a child care facility that's licensed by the state. And the little green plus here, shout out to Jen Shepard for helping me create that beautiful little graphic, represents a hospital because the essential workers were largely at hospital locations. So it was important to show the proximity to these healthcare centers. Building a really nice tooltip provided contact information for that particular provider that you're hovering over, as well as information about whether they had any slots available for certain age groups, their hours of availability and operation, et cetera, et cetera. But again, it still basically required a phone call or an email on the part of a family person. My understanding anecdotally through our program and policy people is that there were thousands of connections made where people were contacting childcare providers to line up care for their kids. We can only assume, but can't prove, that this was a tool that they were using for that. Technical challenges of this particular build. Well, number one, there was actually the speed with which it was requested and required. I didn't put that on here. But initially, the data sets that we were working with were disparate and not very well put together. We had an amalgamation of our data warehouse data about childcare providers, which we have all the time, every day for the last several years. Great. An Excel file which provided information about Wisconsin hospitals, a different Excel file which had individual educators, which are basically teachers or caregivers who volunteered to either babysit or help a family. And then because of the rapidity with which information was coming in and people were standing up facilities, we didn't have time to wait for the routinized systems to do geocoding to give us address and information about all the locations. So we created a separate file for that, and I would just manually geocode things every morning and put it back out there. All of this union together to form a singular data set, which Tableau Desktop does not do. You can't query a union, you can't union a query of Excel, but you can in Tableau Prep. So this was actually our first project that we did in DCF that used Tableau Prep as a core piece of the foundation to build the data structure. Just a few extra notes here about technical challenges of reading from our Oracle side, our file shares, different locations, different schedules that we had to have created by the Department of Administration, et cetera, et cetera, et cetera. And long-term, all of these things were eventually brought into data warehouse structures so that we could read those as regular queries. And we ceased using Tableau Prep and shifted over to just using a regular query that pulled it all together at once, which has worked great. And it's what we continue to use today. The other dashboard that we built, again, this is the very last product that we put out, has to do with a program that was funded as part of the Congressional CARES Act, where all this money was put out to states to assist them. And sort of as part of that, $51 million was set aside and allocated for this Child Care Counts program, as it's called. And what it did is provide money to childcare providers to help pay for them to remain open, to help pay for staff, to provide incentives to pay their staff more in order to come into work, and even to help keep the lights on and pay the bills for providers that had temporarily closed, but that were expected to reopen. The actual purpose of this dashboard is not about who to pay and how to pay, but rather to provide extreme, excruciating transparency about where all that money went. Here's a little bit more of that background. They needed this to be really timely in that as soon as the money was put out there, because we're talking $30 million, then $15 million, and then another $16 million that went out in 3 cycles. Where did that money go? Joe Q Public wants to know. The Milwaukee Sentinel Journal wants to know. So this dashboard was intended to be very transparent, immediately available for people to ask their own questions and get their own answers. And to the 4th bullet point down below, to shield our staff at DCF from these information requests that were very simple in nature, but which started to come in very quickly in a high quantity. Like, how come I got this? And how much did they get? And what did this other provider get? And how come Dane County got more than Sheboygan County, et cetera, et cetera, et cetera. So this dashboard was really focused on self-service question and answering by whomever wanted to have some information related to childcare counts. We did build this in a very planful way, anticipating that as each funding period closed and we needed to get the data back into the dashboard, it was going to be a very short timeline. It actually works out to about 6 business days from the moment that the funding period applications are closed off. They decide how much to pay, and then we have to put it back into the dashboard. Here's a little bit of the information about how they use it. In the interest of time, I'm not going to actually open these dashboards and interact with them because I know we are a little bit behind. But this is an overview of the entire program, showing how the funding broke down between the 3 funding periods, between March and April, April and May, May and June, and the 3 programs that were involved, and the subtotals that were allocated within each period. And you can see that there was a decreasing amount of money that was available and put out. In funding period 1, $32 million was sent out to all the providers that had applied. In funding period 2, less than half of that, at $14 million. And then in period 3, there was only $4 million remaining that was also provided to childcare providers. Down below is what you would see in the tooltip if you hover over a specific map mark and see what each individual provider was paid throughout the entire program, in total and per program and per funding period. This was really a challenge to provide enough information about each of the providers without providing too much, any personally identifiable information or something that was related to the staff there. These are all facilities, even if they're named after a person. So again, some challenges that we had to face with this was that the data was new and it was being created like the day before we were going to get it in the application system that was going to use it. The financial processing was part manual, part Excel spreadsheet, part ACH, and then it came back to us through application tables and we put it in our data warehouse. So it was a little bit of a wonky zigzag in how the data was coming through, but we cleaned it up as it came in. Just as a side note, we built for DCF an internal use product that they used to review and analyze how they were going to pay people and make sure that the distribution of money was fair, was balanced, made sense, didn't go up criteria in terms of deciding what should each provider get paid for each kid that they had, for each staff person that they had, for their particular situation, and then normalize that across all the providers and see how that played out. As I said before, the time frame between applications closing and our dashboard was about 6 business days. Included in there was the actual decision making about payments and the payment process itself. And then finally, because we weren't sure if this program would get extended, I built it so that the data ingestion and the constructs of this dashboard are easy to add to. We can easily add data to, which I'm just going to point out. I just found out last night they're adding more money to this program, and we are in fact going to have 2 more rounds, I believe, of childcare counts. So thankfully, I don't have to go back to the drawing board for that, and we can just bring it in. And as I mentioned a moment ago, the big design challenge was providing enough detail and information for it to be transparent and not seem like DCF was hiding anything about how and whom providers were paid, but not so much that people could be prying into their neighbors or their competitors' business too much. This is really just, this provider got paid this much from this program, And that's how much is in there. Okay, I realize that was a very fast blast through. And again, just trying to be respectful of time for Jen and others that follow me. Any questions?
Robert, would you mind taking those in the chat if we do have people?
Absolutely, yep, I'll take those in the chat, sure.
Thank you.
All right, I'm gonna stop sharing, all yours, Jen.
All right, thank you. So my dashboard that I'll be talking about today, I'm actually not going to show you the live version that we used within DCF because of sensitive data, but it is very much in the spirit of what I created. And this dashboard was really focused on answering a central question for our leadership, which is where are the childcare needs versus where is that childcare available? So the data, as Robert has said, was coming in rapidly. We didn't necessarily have it all at the get-go. But for this particular dashboard, I basically had these two sources. We had the childcare requests that the parents were telling us, hey, I have this many kids. I need care on these days. Here's my info. Here's my address. And then we had the provider side of that. So the licensed childcare facilities or the individual educators, people who are willing to take these children. We knew information about how many children they could take, the age groups, contact info, and so on. The only thing that these two sources had in common was basically the zip code of where the parent was and where the provider was. So doing a full outer join of these two data sets, matching all the records that had the same zip code to all the records that had that zip code across all of these thousands and thousands of records was just not really an option for us. We were going to have to refresh these very rapidly. It needed to process quickly. So with that option not available to me, what I did instead was blend the data so that I could bring in all of the requests so we knew where our needs were for childcare and then show where we had providers in that same zip code. So not ideal solution, but under these circumstances and in the tight time frame that we had to work with, this was the best that we could do for our leadership with what we had available. So the dashboard itself was pretty basic. So it was basically just this map where I plotted the requests versus the supply, or the gap versus the surpluses in childcare providers by zip code level. So you'll see there's very little interactivity here. There is the ability to filter by county and zip code, but that was pretty much it. And that was a deliberate design choice on my part because this wasn't for our analysts. We do build things that people who are really into data like to play with, but this particular dashboard was for our leadership. They had their question, they wanted to know the answer, and they didn't want to have to mess around to get to it. So the piece I'm going to share a little bit more with you today is more of a tip or a how-to. So the coloring is an indicator of whether we have a gap or a surplus here. And I guess I should also point out, even though these are fake data, on the real dashboard, I did make sure people knew that we're only including zip codes where we had requests. There was childcare available in other areas. But again, due to the way the data were stored in these two warehouses, we did not do that full join. So I have my disclaimers on here. But basically the only interactivity was this hover. So I could have just put the numbers you see there at the bottom that we had 38 slots for kids and we had 5 kids who needed care. I could have just put those numbers, but because this was for leadership who wanted to get to the answer quickly, I took that a step further. And so I gave them that mathematical difference of the 33. And then I took that a step further and I let them know that's a surplus. We have more capacity there than we have need. Or a county like, or a zip code like this one, I put the word there, we have a gap. And then I took it even one step further and color coded that tooltip so that they could tell right away, is this a gap, is this a surplus, how big is this? So when you have a zip code out here by itself, and again, these are fake data, but it looked a lot like this in terms of the colorations, it's not so hard to realize, okay, there's a gap here. But when you're trying to find a smaller area down in here, I wanted it to be really readily apparent that they are looking at the zip code they meant to select. So in this case, I'm trying to find this one that looks orangish. Okay, yes, that's the gap. So I'm going to show you a little bit about how I did that. Hopefully this will be a helpful tip for some of you. And it is a little bit of extra work for the analyst, or I should say a little bit of extra work for the developer, but in this case where it was a management level dashboard, I felt that it was absolutely worth it, trying to take as much of the burden, the mental processing burden off our leaders as possible. So the way I did this is with a series of 4 calculations. So the first one is just looking at the actual difference between our 2 numbers. So let me zoom in here. So I just took the number of slots that we had for childcare and I subtracted the number of kids who needed care. And you'll notice I did wrap that in the null function because I wanted, if there were no slots in this zip code, I wanted that to return as 0 so that we would see that there was a gap there. So that's just the difference, and that's what's on the color shelf to show the two different sides of that full range. And then the next calculation is putting words to that math. So if that difference equation is less than 0, then give me the word gap, otherwise give me the word surplus. So again, making it easier on our leaders to see what they were looking at. And then 2 more calculations. One, when we were in a surplus situation, so if that difference between the 2 numbers, the slots versus the need, was greater than or equal to 0, then tell me what that number is. Otherwise, don't tell me the number. And then the other equation was just the other half of that. If that difference is less than 0, then give me the number. Otherwise, don't. And I did actually multiply this by -1 because I didn't want them to see a gap of -5. That's basically a false, what do you call those? A double negative. So I multiplied by -1 so they would all be in the positive direction in the numbers, and it was the word itself that would tell you whether it was a positive or minus. And the reason I did those as 2 separate equations is because then I could bring both of them into my tooltip and format them separately. So I put these the 2 equations I just showed you, side by side. I colored one, the orange color, to match the gap side of this divergent color palette, and I put the other one in blue. And the reason this works is because only one of those can be true at a time. So for any particular zip code, either there's a gap or there's a surplus. It can't be both. And therefore, only one of these 2 numbers will show, and it will be colored in the color that I want it to. So again, just a little bit of extra work, a couple extra calculations, but then you get that effect where if you hover over an orange zip code, you get the orange text. If you hover over a blue one, you get the blue text. So maybe some of you have seen that tip before. Hopefully it's new for some of you and might help you out in some of the work that you're doing. I think our leadership found that pretty valuable. And then I'm not going to go into this one today, but because I plugged our Slack site earlier, I'm going to put in another plug for it here and say that one of the other dashboards I worked on was looking at, we had staff who were actually making calls to these families and trying to help them match up with childcare. And the managers of that call center wanted to be able to monitor how many requests do we have still open, where are they in the pipeline, how many have been stuck, which team has too much workload. So they had questions along those lines. So I built a dashboard looking at those metrics. And one thing I did with that is gave them a little bit of a spark line to show how many requests have we received over a time frame. And so my challenge to you, if you're trying to improve your Tableau skills or just want a fun exercise, is to maybe open up Superstore or something and see if you can build this look. And I'll post a little bit about this in our Slack channel, and I'll follow up with the answer on how to do that. But it's our own little Madison Tug version of Workout Wednesday. See if you can build yourself a little spark line. So not just a plain old line graph, a special one. So hopefully some of you will accept that challenge and join our Slack channel. And that's it for my presentation. Next, we'll be hearing from Olivia and Kate and Chris over at the Department of Health Services.
Hi, everybody. I'm going to share my screen really quick, and then we will kick it off. Can you all see everything?
We can.
Okay, good.
Hey.
Kate, do you want to kick us off?
Yeah, I would love to kick us off. So welcome everyone. Hopefully you all got like a midday tea or coffee or something. We appreciate the opportunity. So we're from the Department of Health Services to share how we have used our response to COVID-19 and how our data strategy has evolved through the pandemic. So just a couple things to mention at the beginning. We've had a couple commitments to data and transparent data throughout this. So every day we've provided up-to-date reports of many different data points in our response. To provide this level of data every day is unprecedented. So I think Robert talked about this too, that they've been doing much quicker refreshes, much more agile than ever before. And our team has risen to the challenge. And then our second commitment is also to clean and accurate data. So there's a balance between timely and accurate. We've had a lot of discussions around that. It does require us to freeze our data at a certain time every day to prepare it for reporting and posting on the website. And then our third commitment is to display a variety of different data elements to understand the pandemic and use our analyses to drive our decision making. So sometimes it means we bucket our data into different categories. So thinking by age, gender, race, or ethnicity. And other times we look at data trends over time. So our goal has really been to give Wisconsinites the information they need to best understand the situation and give the most accurate picture of the COVID-19 pandemic in Wisconsin. So the DHS website has earned a grade of A+ from the COVID Tracking Project, which is pretty exciting for all of us here. It's an indicator that this is a place people can trust to get their data. So moving on, we have a little bit of bios here that we put together. So you kind of met me already, but I'm Kate Rifkin. I'm a data and evaluation specialist at DHS. I've worked for several years to help guide a dedicated group of Tableau users and build an organizational structure for Tableau at the Department of Health Services. I've been working on the COVID-19 data response for the past several months in several roles, including project management, strategic data planning, and the occasional but enjoyable dabbling in dashboard development.
Hi, everybody. So I'm Olivia Butler. I'm the data management liaison for DHS, and I currently serve as the Tableau site administrator for the COVID-19 response. So that means I've been the primary person managing and supporting Tableau server, as well as liaising between the development teams and the web team. I also serve on the leadership group for the other Madison Tug group for the state of Wisconsin Tableau users, and trying really hard to support Tableau across the state. So COVID's been a really unique opportunity to dive into that.
Hello, I'm Chris Heward. I'm a senior research analyst with the Office of Health Informatics. Currently, I'm serving as the Tableau development project manager for the COVID response, and I play a key role in coordinating the developers and managing the workflow. So thanks again for joining us today. Let's take a quick look at the agenda. Today, we're going to provide an overview of COVID-19 in Wisconsin and the response effort, describe how we built the infrastructure to support COVID-19 visualizations, explain how we scaled that infrastructure, demonstrate how we worked through the design process, and also give you a preview of items yet to come. By the end of this presentation, we hope you have a better understanding of how Wisconsin has leveraged various resources to successfully implement Tableau for visualizing COVID data. So with that, I'll turn it over to Kate, who will talk a little bit more about Wisconsin and its response efforts.
Yeah, great. Thanks, everyone. So curds and curves, a little bit about Wisconsin, which, by the way, takeout cheese curds, not as good as getting them in the restaurant. So if anyone has suggestions for really good takeout cheese curds, post it in the chat, please. So Wisconsin, as most of you know, is known for cheese curds, Packer Nation, and our unique reference to water fountains as bubblers. We have a population of about 5.8 million residents. Largest cities, Madison, Milwaukee, and Green Bay. So on this slide, you can see the epidemic curves, or the epi curves, for COVID-19 cases over time and new daily cases. So these are actually from our Department of Health Services website. I'm sure most of you have seen these over and over in the news and on visualizations, but for those of you who don't know, an epi curve helps us to visualize a disease outbreak over time. So these are important tools used to help track COVID-19 spread. And when COVID-19 began, Wisconsin, like many other states, was not immediately equipped to handle a pandemic. As many of you know, if you're working with your own data systems, they're usually many years old. And so it puts a lot of stress on the system as well as staffing resources. So we quickly ramped up through the support of the State Emergency Operations Center, which allowed for analysts and other staff to come help support us. So as you can see, Wisconsin has features that are unique and common across states. We can go to the next one, Olivia. So just a little bit about our timeline. Our first case was confirmed in early February. It wasn't until early March that our second case was tested and found to be positive. As cases increased, the state began to take action to mitigate the spread. Our primary goal was to reduce burden to the healthcare system early on by increasing testing capacity, contact tracing, and PPE. In May, we could see that we'd successfully flattened the curve. However, as the state began to reopen, COVID-19 infections increased. So from a data viz perspective, what that meant for us is that we shifted our response to incorporate more granular data to help our local partners monitor the status of COVID-19 throughout the communities. And I like this wind blown thing I'm getting right now. It's very windy out here, so it's like a modeling shoot. Guidance is continually updated to reflect changing trends in COVID-19 as we learn about how it spreads. So front and center on here, you can also see in our governor's most recent executive order. Oh, we're still on that one. Actually, our data was featured front and center on there, which was pretty exciting. You can go to the next one. Thanks. So this is just an example of how data has driven our policy in Wisconsin. So we created metrics to help inform the public on when to reopen the state. So Governor Evers passed the Safer at Home order on March 24th. And when it was enacted, we needed to have metrics available to decide when to start lifting restrictions. So these criteria were called Badger Bounce Back. And so these were statewide metrics focused on things like COVID-like illness, hospital information, and healthcare worker information. So we used Tableau to display these metrics both externally and internally. And the metrics have been used by local health officers as well as businesses and communities. However, as we've moved through this, we've had to kind of shift our focus to more county level and other local level metrics. You can go on, yeah. So just talking a little bit about getting started. We have had a lot of teams involved in our data response. So a huge shout out to all of those who've stepped up to help. A few groups just to mention quickly, epidemiologists. So off the bat, they were our data experts in communicable disease. Our geospatial mapping team has helped a lot. Our Office of Health Informatics has dedicated researchers, modeling support. And then our Tableau team, we had kind of a Tableau team to spin up during this response with developers from across the department. And then our State Emergency Operations Center had project managers, analysts, and other staff to help support our response. In terms of data source prep, a lot had to be done to get the data into workable formats for the public. So a lot was manually processed in the beginning, and it was a barrier to get it into Tableau right away. So it took a lot of work to get it into the correct fields in the background data. We had a lot of times when we thought we were ready to go to production and we realized that the backend data needed another update. Internal data sharing was also really important to provide de-identified views to analysts to kind of ramp up and scale up. And then data education. So we'll talk a lot about this later, but the pandemic has required a lot of data education. We've never had this much interest in our data systems or field definitions or data dictionaries. So that part is exciting, but it's meant a lot of work on our part to really make sure we educate people. Go to the next one. Thanks. In an attempt to simplify our work, we've bucketed it into 3 different phases here. So phase 1 was a lot of manual extracts and static visualizations with a focus on developing standardized reporting systems and team organization. There was a focus on rapid fire requests through the deployment of visualizations. Other things to mention was buy-in and support for enhancing our data platform, cleaning and creating new data tables, and a lot about messaging. Phase 2 involved automation of common data sources, so getting things on an automated refresh schedule, improving connections with partners to provide feedback on visualizations, developing consistent standards for teams, and then phase 3 involved finalizing automation of secondary data sources, optimization, so what are the questions and how can we best optimize the products that we have out there, some of our wish list development, and then also device accessibility and improved sharing for internal content. So one quick example, because we all love examples, of how we evolved our visualization response is our probable case visualization. So we originally didn't report probable cases, only confirmed cases. However, as definitions changed nationally, we adapted our process to report several options, including, as you can see here and what's on our website, confirmed cases, probable cases, and confirmed and probable cases. So the second screenshot on the right shows our continued evolution of this visualization where we developed a mobile-friendly layout. And the ability for Tableau to make these quick changes and reduce build time has been one of the reasons we chose to use this software. And I'm going to pass it to Olivia to talk more about Tableau.
Hi, so I probably don't have to tell very many people in this group how amazing Tableau is. There's several reasons that we have listed on the screen, but DHS really had a decision to make because of all of those pieces that Kate just talked about in terms of the rapid fire requests and our need to respond quickly and accurately. So we made the decision to use Tableau when we needed to have automated data or we had multiple different data sources to connect across our system. It was the easiest way for us to allow for that kind of agile building process when we have these high priority requests coming in and data needed to be displayed by the end of the day. It really made it easy for us to connect all of these different pieces and build a visualization in a timely manner that was also simple and straightforward. So like Kate mentioned, designing for our public was really important in making sure that the visualizations are visually engaging as well as informative is important. And the last part that I really want to bring attention to is the Tableau champions at DHS. We are really lucky to have a very robust Tableau community, and a lot of our developers and analysts have really helped champion Tableau and get more licenses into the department and teach each other things. Because Tableau is so easy to learn, we've been able to really share our knowledge, share best practices, and build out these visualizations using developers that have just got a license within the last couple of days, all the way up to those that have been using the tool for a really long time. And this has really also helped socialize socialize Tableau at DHS so that I think we've got a good foundation for moving forward and have really demonstrated its value throughout this response. So this is a great example of the coordination between all the different agencies that have been a part of the state's response for COVID-19. We have multiple lab-related data sources, and a lot of our partners helped make this data available and connect it and build it in Tableau. It is automated, so the dashboards that we build for our public all update by 2 p.m. daily. We've created an expectation with the media to make sure that we are able to show these different critical metrics, as well as informed decision making. This dashboard is a public-facing dashboard, but it's also used by leadership to help inform decision making and determine where we had testing capacity deserts or inform where we needed to make policy changes to address shortages. So Server really allowed us to de-silo all these different separate operations and provide a cohesive set of data for our leadership. So I want to talk a little bit about our Tableau infrastructure at the state as well, because it plays an important role in how we were able to use Tableau, leverage Tableau for the COVID-19 response. One important item to note is that DHS participates on a shared server that the state of Wisconsin purchased. So it's not just DHS on our server environment. There are multiple other agencies that also participate. And while we own the site administration role at DHS, our Department of Administration is our server admin. So it's important to coordinate between those different functions as we had to kind of rapidly respond to all of these new challenges that we ran into along the way for COVID-19. One of the things that we did was centralize almost all of the COVID-19 content for the State Emergency Operations Center onto the DHS server. That was great in that all of our data was in a single place for us to be able to send leadership to see that content, but there were a lot of challenges in that we have a bunch of users that are scattered throughout the networks that we had to get added in and manage permissions for at various levels because while our COVID-19 data is de-identified to live on our server, there's different levels of visualizations. Obviously, those geared for internal decision making and leadership review have to be a little bit more locked down than some of our public facing content. And trying to manage all of that was definitely a challenge for us that we hadn't faced before. DHS's public facing visualizations are also all embedded on our webpage. So we did combine a lot of our design standards to create a branded look for DHS content. We wanted the content that's embedded on the web pages to feel like it came from the same developer, even though we have, you know, several developers working on all of this different content. And the way we also helped facilitate this was we created a hybrid role between the site administrator function and the web publishing function so that we could ensure that all of our content met those standards that we developed and improved communication between the different groups that were involved in the development of the data and visualizations. We also specifically focused on device responsivity during different phases of our response and are continuing to improve the accessibility of our visualizations because we want to make sure that everyone who lives in the state of Wisconsin has the ability to see and access and interact with the data that we're providing. So the next piece is really about more scaling. Like, as I mentioned, we participate on a shared server. So the coordination between the site and server administrators, as well as our Tableau technical support team, has been absolutely critical to address the challenges as we continue through the response. So as I mentioned earlier, we update all of our public-facing visualizations by 2 p.m. daily, and we've created this expectation with the public and the media that that's when they go to see our new data. The challenge that developed after that was we started seeing an average of 500,000 hits coming into the Tableau server each day, which necessitated that we provide more technical resources to support the load that's coming into the server, because we would see visualization caching or visualizations would go down earlier on in phase 1 just because we didn't have the dedicated server resources. So the state actually scaled from an 8-core server environment to a 72-core server to support that increased traffic that we were seeing. So in addition to making changes to the server itself, we also were able to reduce the load that we were seeing by spreading out the amount of visualizations that were on the pages. So instead of having every single visualization we built on a single web page, we split them out into a series of what we call data pages and focused on reducing our workbook complexity and the visualization complexity so that the load times would improve for all of the content that we had. We do use a combination of scheduled extract refreshes and manual data extracts. As Kate mentioned, we still have very siloed data, so we have almost 50 different connections to make sure that we provide the right data at the appropriate intervals for leadership and the public. So sometimes it may be the same data, but it's on a couple of different schedules, just to make sure that leadership had a chance to see that data earlier in the day before we go to the public with it. So this is an example of one of our internal facing dashboards. This is not content available to the public currently. The data that's displayed on this dashboard is also available to public audiences, but it's at a higher level of aggregation and has a couple of other changes where this data, for example, refreshes earlier. The data for our public refreshes at 2 p.m. And we also were able to embed some of our internal facing content, not just on Tableau server, but also on some of our internal SharePoint sites to make it easier for the DHS leadership team, as well as some of our partners at the local public health agencies to be able to access and see this data to inform this local decision making that's happening currently. So as you can imagine, it takes a team of developers and staff to coordinate the development of these dashboards and manage all of these different moving pieces. So Chris is going to talk a little bit more about our content development and design next.
All right, thank you, Olivia. Yes, let's talk about the content development and design. So you may be wondering, how do we choose which visualizations to build and how to build them? Well, generally speaking, the content design is largely driven by the public, often in the form of a data request. Every day, prioritization meetings are held, and these include representatives from leadership, communications, the Tableau team, and epidemiologists. And it's here where they discuss the most pressing questions and how to best triage them. So a request for a Tableau visualization typically comes from this group to the Tableau development team. The group is focused on conveying critical information across all audiences. For example, early on, the group identified that using plain language is paramount, and we must make sure we are presenting information in a way that public can easily understand. So early on, our development team strived to achieve this in language around the main graphics, as well as incorporating that into the tooltip text. So here are some quick examples and responses that came up. So age group, that comes up often. We provide an age group breakdown whenever possible. Probable cases, we saw an example of that earlier, but we are now adding probable cases data to visualizations where we can. Time period was something we had to think about a little bit differently as COVID continued. Had to start thinking about extending it, as well as the small daily fluctuations versus rolling averages, for example. Footnotes, something we learned very early on and are continuing to learn, is the tremendous amounts of data caveats and how to best note that and explain that to our audiences. Local data is another one. Whenever possible, we provide data as granular as we can. And then summary statistics. Many audiences are looking for that quick, high-level snapshot of the data. So here's an example of our summary statistics visualization. This has gone through a few iterations. It's important to show because it's an example where we took feedback from the public to enhance and automate this graphic using Tableau. So on the left, what you're seeing is an image that is uploaded to Facebook every day. People really like seeing this high-level snapshot. In particular, we received a great deal of positive feedback regarding the daily change numbers. Those are noted in the parentheses there, the plus negative. So our development team took that feedback to build a Tableau version, and that's what you're seeing on the right. So as you can see, we were able to integrate the daily change notations, incorporate more information, and automate the data updating, perhaps the most critical part. So this is one clear example where we leveraged audience input to maximize data presentation. Another example is the local data that we mentioned. This graphic presents number of cases over time by day, which is filterable by county. A few notes about this particular visualization. This is the first design where we used symptom onset date, which is a different date field used in many of our prior visualizations. This is important because although the data aren't finalized, by using this onset date field, we are able to capture a more real-time picture and more rapidly identify areas of the state where case activity may be rising. And as you can see, we've also highlighted the preliminary data here as a visual cue to emphasize that component. The decision to incorporate preliminary data was important because due to the time lag in reporting, it indicates that cases may look lower than they actually are as that information continues to be reported for that time period, but it still provides the most accurate picture. So again, this is an example where we used input from the public and partners to guide the way in how these data are presented. And by implementing the new date field and through highlighting the preliminary data, we are able to provide a more robust tool for local decision making. So now we'll just quickly talk about the team a little bit and how we tackled some of these visualizations within the team. So our team is made up of about a dozen developers with varying experience levels. For example, some were completely new to Tableau almost upon starting this effort, whereas others had a fair amount of experience working with Tableau. The team consists of diverse staff from disparate parts of the department, and we even had some external staff hired on as contractors to help with this effort. So many had not previously worked with one another before until this particular effort. It's important to note because at any time they could be working with one another or even as a small team to accomplish any given task. And I can't stress enough how critical the relationships and team dynamics were and still are to the success of this response. So now we'll just talk about the workflow, which is outlined at the top of the slide there from left to right. So we talked about how a new request started from the prioritization meetings. They came to our development team group and they were assigned to a developer or a small team of developers to build. Once they had a draft ready, they sent it on to QA. Once it completed QA, we sent it on to the COVID team, which was another level of epidemiologists that provided more QA and some data validity checking. Once it passed that level, it went to the web and communications team, where we actually put it on a draft web page and we could, look at it on the website for any layout issues, language issues, etc. Once all those steps were completed, the visualization was published and out there in the world. So, and lastly, we'll just talk about our overall process or approach to transitioning these visualizations to Tableau. In a perfect world with unlimited resources, we could have hypothetically done everything at once. However, given our realistic situation, we decided to segment our transition as bulleted on the slide above. So replacing current visualizations was the team's first priority, as these were visualizations already built by another team using different software, but were being transitioned to Tableau. After successfully replacing many of the initial visualizations, the team was able to start tackling new requests, which hadn't previously been displayed. Next came optimization, where the team went back to improve previously published visualizations. For example, implementing a previously unavailable county filter, and or creating a mobile device layout for a visualization. Those were parts of this step. And it may seem out of order, but now that the development team had hit a rhythm and fulfilled many outstanding requests, we finally had some resources to focus on cleaning and documentation. So that step included cleaning up workbooks, standardizing naming conventions, and cleaning up files on the server. Finally, I will say that this was all a very interactive process, and communication within and across teams was vital. We held daily developer meetings every morning where we talked through priorities and assigned requests. Additionally, we held development-focused meetings as needed, where individuals could get feedback on their work from other colleagues and troubleshoot issues with other team members. Again, these are very high-level views of the processes, but hopefully it gives you an idea of how we came together as a team to successfully reach our visualization goals. Here's an example of what that might look like when all these pieces work together. This is a preview of our COVID-19 disease activity and hospital capacity dashboards, which will be going live in the very near future. The disease activity section leads with the COVID-19 case activity levels, which track changes and confirm COVID-19 numbers and trends. The dashboard then supplements this picture by looking at percent of positive tests, estimated number of undetected cases, and people with COVID-like and influenza-like symptoms in emergency departments to provide a more complete picture of both the confirmed and suspected extent of COVID-19 in the community. Each of these areas is then given a category such as low, medium, or high to help with interpretation. And on the right, the hospital capacity section helps further track the impact of COVID-19 on the regional healthcare system by showing trends in COVID-19 hospitalizations and current use of hospital beds, ICU beds, and ventilators. Having all this information in one place can help people understand the current disease situation and how much strain it places on hospitals. Again, I can't emphasize enough how many groups, stakeholders, analysts, scientists were involved throughout this entire process, and this build especially. Again, I would like to thank everyone for all their efforts. As you can see, there is a lot of staff power behind many of these visualizations, and hopefully you've gotten a sense for all the teamwork and coordination required. In other words, how we came together. We've taken a peek at one of our next dashboards to be released. but Kate will talk in a little bit more detail about what's next for Wisconsin.
Okay, thanks, Chris. So just some reflections. So again, our goal really throughout this response has been to make sure that public health decisions are data-driven and promote the health and safety of Wisconsinites. So while we were able to provide a lot of data for internal leadership to drive policy decisions, we've also provided a lot of data for the public to use to make their own individual decisions. As we move forward, we want to continue to improve on the data that we provide. So some of our success stories: coordination between multiple parties. We've effectively pulled together groups within and outside of DHS with common goals and strategies, a prioritization of incoming requests. We have a group that's pulled together across DHS. So it also involves the SEOC, where we run through new requests every day. System connectivity and sustainability. Creating sustainable data connections has been a really great success story. So every request we've done, we've tried to build in back-end automation and processes that ensure the least amount of continued work for our analysts. So we've been working really hard to also use our momentum with COVID and kind of with the money and energy that comes in to connect new systems and develop processes that will continue to serve us in the future. Some of our opportunities for improvement: data connection optimization. So making sure that we're optimizing our database connections into Tableau. That's something we've kind of learned along the way. Server data and content management. So things like naming conventions, making sure that we're keeping up with a number of visualizations on server. Process improvement. So looking at what processes are working. So for example, realizing we needed a lot more discussion with our communications staff on what questions they get on social media every day, so we can tailor what we put out on the website to match that. And then common storage. So finding common storage spaces for workbooks in a state government system is sometimes difficult when you have very siloed divisions and bureaus and departments. And then compliancy. So making sure our visualizations are ADA compliant. Yeah, go on, Olivia.
Okay. I just wanted to make sure you had everything you needed. So what's next for DHS? We are continuing to move forward with our COVID response, but we are trying to switch away from emergency operations and back to normal lines of business. So that means considering the addition of new public health metrics for contact tracing, lab timeliness, and jurisdiction level metrics for our local partners as well, including displaying data by census tract and tribal boundaries. We also are planning to improve data quality by working with our partners at the hospitals, labs, and local public health to make sure that the data that we report is as accurate as possible and that we are collecting all of the right data elements. We also are focusing to improve the connectivity between our systems, so remove some of those silos we've been talking about and set up a more sustainable long-term data infrastructure. As Chris mentioned as well, this process documentation, all of these documentation steps were put aside because of the quick response times that were required for actually building the visualizations. So we want to focus on standards for naming, storage, and retention of our content, as well as making sure that we have dedicated resources and backups for all of our existing developers. And the last thing that I wanted to mention is we are focused on creating a dashboard portal right now for leadership. So we have so much content in so many different places from a variety of our partners as well as internally at DHS. So we're going to create a single location that leadership and other decision makers can go to and see every dashboard that we've built for them in one location. Just to make it easier for them to find, access, and manage the content permissions around that. So as the situation continues to evolve, I'm sure things will change again. We're doing our best to stay agile and make sure that we mitigate the pandemic's impact in Wisconsin, as well as continue to effectively inform the public. We really believe in our mission to protect and promote the health and safety of the people of Wisconsin, and it's definitely been a challenge, but I do feel like everyone has risen to that, and I'm excited to see what comes around the corner. I think for for one of the first times in our life, data is at the forefront of what DHS does, and how we talk about data to our public has become really an area of focus for us. So if there are any questions on any of this presentation, we can answer them in the chat, or you can always reach out to us, and we're happy to share what we know.
Thank you, Olivia and Kate and Chris. We came in a few minutes before. You guys are all amazing for going so quickly. I have a couple of slides I can run through in our last 3 minutes, so you do have a few moments if any of you do want to throw any questions in the chat for our state partners here. But I think I can speak, or I hope I can speak for everybody, that as data junkies and data nerds, I think we can all appreciate the amount of work that this must have been for all of you at both of our Child and Family Services and at DHS. And I just want to say thank you. I feel like you've been doing an amazing job in what you've shown the public. I see it on Facebook and all of that, and you get a lot of flack, and I think you've done amazing. So thank you for that. Thank you for presenting to us today. It was very informative and helpful. All right, so I am going to jump into my last couple of slides, which just give the group, come on, present. It is not going to presentation mode, so I'm not going to worry about it. Hopefully it's not even advancing. All right, hold on, of course. Okay. So a few just program and opportunities. We are always looking for speakers, especially as we want to focus on live and local content for our Madison TUG meetings moving forward. Again, in the spirit of what we talked about early on in this meeting, you have plenty of virtual content you can join, so how can we make it relevant to you? If you're interested in sharing a use case or a story, please reach out. Some of our contact information is listed here on the screen. We do have an e-learning challenge going on. You should have received an email about that. So if you are an e-learning participant, Tableau e-learning, you can get in on that. So contact us for more information if you have questions. This slide also references some Tableau offerings. Just a reminder that that students and teachers can get Tableau for free. It includes Tableau Prep. You can visit this website for more information about that. The online Tableau community forums are all refreshed and new. If you haven't checked those out, you should. There's some fun Tableau Data Kids content, lots of activities. I have 3 little ones. I definitely love to do this type of stuff with them. And then all virtual content is available on YouTube. Just Google Virtual Tableau User Group Playlist and you will find it. And last but not least, a few save the dates. The next Wisconsin, so not just Madison, but all Wisconsin virtual TUG, which is co-planned by the Milwaukee TUG and our Madison TUG. That is scheduled for October 2nd. Tableau Conference is live and virtual October 6th through the 8th. More information will be coming out from Tableau on that, but save the date. And then we will plan to have a Q4 meeting just like this. And stay tuned. You can always look at the user groups page. I guess that didn't show up very nicely, but to see those dates moving forward. And that is it, right on the dot at 3 o'clock. Thank you all for your presentations and for your attendance and participation. And we look forward to seeing you next time.
Everybody who's left, you're all really hardcore. we all have other things that we need to move on to. So thank you so much for coming. I'm going to be closing the meeting now.
All right.
Bye.
Nice job.
Thanks, gang.